Good afternoon. My name is Brian Lawrence, and I'm the Deputy Executive Director at the Seattle Public Library Foundation. And I'd like to thank you and welcome you to our webinar with Dr. Nancy Bristow, author of American Pandemic. I am particularly excited about today's program. I learned about Dr. Bristow's work when I was listening to an episode of The Hidden Brain on NPR. And immediately after hearing her talk about the parallels of the Spanish flu, as it was called, we researched Dr. Bristow and learned that she is the chair of the history department at the University of Puget Sound, which is, of course, right here in our own backyard. So today she'll share a presentation and answer our questions about the parallels between back then and the crisis we face today with COVID-19. All of you are our wonderful supporters. You're our donors, our library volunteers, and the advocates who champion our library across their neighborhoods. So we are enormously grateful that you are here to listen, to learn, and to gain knowledge from this wonderful presentation. Our donor family has shown the library a lot of love recently, and together we've been able to help SPL provide free books to children, access to Wi-Fi hotspots, and support for the collections. And this has really helped the library increase the number of materials it can offer in electronic formats. And starting tomorrow, you'll be able to access physical collections once again, as the curbside services begin at select locations. So again, we appreciate your incredible generosity in supporting the library. Today's event is the first event in a 5-part Stay Home Summer series. Throughout the month of August, you'll receive invitations to these donor appreciation events, and we hope you can join us for as many as you wish. So today's presentation with Dr. Bristow, as we mentioned, she is the History Department Chair at the University of Puget Sound. She teaches 20th century American history with an emphasis on race, gender, and social change. And so I'm going to share my screen now with Dr. Bristow's presentation. Then we'll go live with our Q&A. So just one moment while we fire up that presentation.
Thank you so much. It's an honor to be here. Anytime I can do something for the library and for our public libraries, I really do consider it an honor. And I'm excited to have a chance to talk today about the pandemic of 1918 and COVID-19 and the strange parallels. So let me start with a short story. In the midst of the influenza pandemic of 1918, the Baltimore Afro-American newspaper detailed one of the most pitiable cases of the costs of racism in the midst of the crisis. Describing an unknown man who was found unconscious, the paper detailed the struggle of finding space for him in the overcrowded Providence Hospital, the local Black hospital. It was already overwhelmed by the demands of the pandemic, and so they were looking for a volunteer who could take charge of his care. This is one of the extremely sad cases that are the pitiable result of the Jim Crow policy practiced in white hospitals of the city, the paper concluded. Now, fast forward to 2020. Toward the end of March of this year, Gary Fowler, an African-American man living in Detroit, began feeling short of breath. Well aware of the growing risk of COVID-19, Fowler visited 3 different emergency rooms, pleading for help with his worsening symptoms. He asked for a coronavirus test. No one helped him. As it became more and more difficult for him to breathe, he began sleeping in a recliner while his wife slept nearby in a bed. Sometime during the night of April 6th, he wrote down heartbeat irregular and oxygen level low. The next morning, April 7th, he was found dead by his wife. Mr. Fowler was only 56 years old. In the midst of the COVID-19 pandemic, though segregation like the Baltimore Afro-American described is now outlawed, the consequences of white supremacy in the midst of a global health crisis are no less visible. And this isn't the only striking similarity between these 2 pandemics. Now, I'm well aware there are lots of differences between what happened in 1918 and what's happening now. We have ready access to air travel, which ensured that COVID-19 would travel internationally and very quickly. And quick identification of the novel coronavirus has given us the ability to test for the infection and to conduct research that will lead to a vaccine. Ventilators and antibiotics are saving lives, and the ease of information sharing allows each of us access to the most current understandings of experts, even as it also allows the easy propagation of conspiracy theories and terrible misinformation. But despite these differences, what's been most striking for me about COVID-19 are the parallels with 1918's influenza crisis. So today I want to talk about 6 ways in which I think our experiences are really replicating those of 1918. But of course, to do this, you need a little bit of background on 1918. So first, just some brief background. During the early spring of 1918, the first wave of influenza swept through the United States, largely unnoticed and unheralded, indistinguishable to the general public from regular cases of the flu. But the virus started to attract the public's attention when it traveled to the Western Front, where World War I was raging. It sickened first soldiers and then civilian populations in Europe, and then quickly spread around the world. It mutated then into the deadly form responsible for the horrors that we associate with 1918, when it struck then in a second wave in Sierra Leone, France, and the United States almost simultaneously in late August. Within just 2 months, the entire world was infected. Another wave followed that winter, and a fourth wave then followed the next year. It was the second wave, the autumn wave, that was most costly. Perhaps 1/3 of the existing human population, some 500 million people, were infected. American infection rates were a little lower, with about 1/4 of our population infected, 25 million people. The mortality rate was 25 times that of seasonal flu today, and some 675,000 Americans died, lowering life expectancy in 1918 by 12 years. Roughly half of the American deaths, and this is part of what made it such a catastrophic event, were between the ages of 20 and 40, rather than only the elderly and the young. And it sometimes struck terribly swiftly. People might wake up in the morning healthy and die before nightfall. Put simply, this was a shocking and horrific illness and pandemic. So let's turn to the parallels. In November, I gave a talk at the National World War I Memorial and Museum, and in closing, I said these words: "We know today that epidemic disease is not only a thing of the past, but also likely part of our future." Okay, even though I said those words aloud countless times over the last 20 years, in fact, I am surprised, as the rest of you, to find myself living in the midst of a pandemic. Unfortunately, it seems like my own lack of preparedness, both intellectually and practically, is a national phenomenon. Parallel 1. Americans in 1918 were stunned by the Great Flu, describing the pandemic as a horrible nightmare, like a plague of olden times. Americans' shock at the pandemic reflected their belief that such a thing wasn't supposed to happen to them. Over the preceding half-century, bacteriological research had led to revolutions in public health and medicine. Scientists had discovered the causal agent for several diseases, ranging from diphtheria to yellow fever, confirming germ theory and enhancing the possibilities of preventing lots of troubling diseases. These advancements encouraged the growth of the public health movement, and by 1918, public health leaders were expressing real confidence in their ability to control disease. Epidemics, they trumpeted, were a thing of the past. Such confidence, of course, slowed public health responses to the looming threat in 1918. And we've seen much of the same in 2020. President Trump, for instance, was seemingly surprised, as I was, by the advent of the pandemic under his watch. Who would have thought, he queried in March. Perhaps he'd been swayed by his own optimistic pronouncements. On February 24th, he had told the president, the coronavirus is very much under control in the USA. On March 2nd, he declared, the United States is right now ranked by far #1 for preparedness. On July 1st, as cases were rising precipitously, he could still tell Fox Business Network, I think we're going to be very good with the coronavirus. I think that at some point there's going to sort of just disappear, I hope. The belief that we were somehow going to dodge this global bullet did not encourage the rapid response we needed. And such presidential missteps haven't stopped, but have continued to complicate rather than facilitate the national response to COVID-19, another parallel to 1918. When the pandemic hit in the fall of 1918, the United States was in the closing months of World War I. President Wilson had relied on the selling of government bonds, the Liberty loans, to finance the war. And the East Coast was already buried in influenza Wilson chose not to delay the fourth Liberty Loan Drive of the fall. Cities and towns across the country, anxious to demonstrate their patriotism, used large public events to kick off local drives, and the results were often quite costly. On September 28th, for instance, Philadelphia hosted a massive parade through downtown, pictured here. 3 days later, the city counted 635 new influenza cases in a single day, a sign of what would prove Philadelphia's catastrophic encounter with the pandemic. Wilson also failed to halt troop shipments to Europe, encouraging the spread of the disease not only inside the US, but also sickening thousands of American soldiers. Perhaps most shocking, Wilson never spoke publicly of the pandemic, ever. Now, if Wilson's silence is striking, President Trump's ongoing commentary has often proved misleading, divisive, and counterproductive. According to CNN, between January 29th and May 3rd, the president had made 215 false claims about the coronavirus pandemic, ranging from his March 6th comment that anybody that wants a test can get a test, to suggestions that President Barack Obama had left the strategic national stockpile empty of ventilators. There were his remarks about the possibilities of bleach as a treatment and his repeated advocacy of the use of hydroxychloroquine, a medication for malaria with serious side effects, as a possible treatment. In turn, and perhaps most troubling, the president's refusal to wear a mask has politicized and thereby undercut the practice of this basic public health protection. And finally, there were the tweets encouraging protests against social distancing that demanded liberate Michigan, liberate Minnesota, and liberate Virginia, and save your great Second Amendment. It is under siege. None of this has helped the country fight the pandemic. So, without federal leadership in both pandemics, responsibility for controlling the pandemic has really fallen on state and local political and public health leaders. And the result, as I'm sure we are all very well aware, are the wildly different responses to the pandemic that have emerged. The strategies available for containing influenza in 1918 were largely the same as those we're using today: education, hygiene, social distancing, closures, masks, and quarantines. Now, like today, each community had a response that was shaped very much by the local conditions of that community, and in particular, the strength of the public health board, of the political leadership, and of their relationship. Some cities, like Milwaukee, Wisconsin, faced the pandemic well prepared with a robust public health system, one that had been made all the stronger by recent progressive era reforms. In other communities, like Newark, New Jersey, handling the pandemic was complicated by tensions. In fact, I would call it open warfare between local and state leadership, and between public health and political leadership. In still other communities, such as Philadelphia, political corruption delayed or undercut the response to the pandemic. And in San Francisco, the simple failure of leaders to lead through example led to citizen resistance. Now, the Seattle area has actually been well led in two pandemics, I think. Turning to 1918, the city's health commissioner, Dr. J.S. McBride, in concert with the mayor, enacted over the course of the pandemic increasingly strong public health measures. He began with usual calls for self-quarantining and enhanced ventilation and fulsome enforcement of the already existing anti-spitting laws. But just 1 day later, 1 day after the announcement of the first death in the city, they closed many public amusements as well as churches and schools. When flu persisted, they took additional steps, opening an emergency hospital, employing tougher punishments for breaking the anti-spitting and public closure rules, putting in place a public masking order, and shortening store hours to ease the crowding during commute hours. Seattle's response, in other words, involved early imposition of interventions, a persistent use of those interventions, and a willingness to maintain them and reimpose them if it was necessary. In 2022, we've been really fortunate, I think, here in Washington and in King County to have strong and informed leadership that's acted quickly and transparently to protect us during the pandemic. Alternatively, the different responses of other states and cities is perhaps too well known to require much recounting. Stay-at-home orders were put in place over the course of several weeks, and some states, North and South Dakota, Wyoming, Arkansas, and Nebraska, have so far refused that kind of measure. Masking and closure orders have also been widely varied. Now, the states begin to imagine emerging from our lockdown orders, even as new spikes are occurring nationwide. And in fact, as I understand it, the United States, with 60,000 new cases in a single day, has just become the nation to announce the most cases in a single day since the pandemic began. And that, of course, is happening today on July 9th. On some level, the idea that states are acting in different ways is appropriate. We will need to open with great care to the local conditions. But that said, the images of crowds protesting stay-at-home orders, of crazy scenes at Lake of the Ozarks on Memorial Day, and in fact of crowded beaches on the 4th of July on both coasts, these are worrisome. Now, the reason those images are so worrisome, so troubling, is that the evidence from 1918 is really clear. Public health restrictions save lives. Seattle's per capita death rate during the 1918 pandemic was one of the lowest on the West Coast, significantly better than that of San Francisco, and half of that of some cities. Philadelphia, alternatively, where 200,000 people, 1/9 of the city's population, had turned out for that Liberty Loan parade, that city suffered desperately. The city's morgues were overwhelmed, resulting in gruesome scenes of, quote, row upon row of unburied dead. And both city workers and divinity students were called on to help build mass graves. The city lost 17,500 people over 6 months of crisis and suffered one of the highest death rates in the country. Broader research confirms that measures such as prohibition on public events, the closure of public spaces, and quarantines, if put in place quickly and maintained over the course of each wave, lowered morbidity and mortality rates in 1918. And this had a secondary impact as well, as it appears that these communities also experienced faster economic growth in the aftermath. Now, it may be too early to offer definitive conclusions. In fact, I'm sure it is, to talk about exactly how things are going to play out with COVID-19. But already we've seen evidence here locally that the early imposition of social distancing, closures, quarantining, and masking has served us really well in the Puget Sound region. What's not yet clear is the comparison to other communities, those with laxer restrictions or those with greater citizen resistance. We don't know yet, but already relatively clear is that here in early July, the rapid increase in cases seems to suggest a high cost for those who are opening too early. And so that turns us really to what is perhaps the most important or most obvious parallel, and that's the reality that in 1918 and 2020, the suffering and trauma in our communities is simply immense. It's not coincidental, perhaps, but it was in the blues that music remembered the pandemic. I'm not going to recount the trauma. I think given our current circumstances, emotions and feelings are far too raw for that. But I will point out a couple of similarities about that trauma. As was true for many families in 1918, separated because of the war, those who became ill then and those who become ill now are often separated from their families, and today are weathering the coronavirus separate. Today, as in 1918 as well, the sorrow of loss is sometimes exacerbated by public health measures that prohibit the proper laying to rest that many people would prefer according to their traditions. And the economic trauma, the economic consequences of the pandemic too, have devastated people across the country today as it did in 1918. And in both cases, we've moved far too slowly and inadequately to protect our most vulnerable populations. And this returns us to the stories with which I began, and the reality that this suffering is inequitably distributed. Too often, it is tied to a person's social identity, my final parallel. In 1918, in an age of strict adherence to gender roles, for instance, men and women faced different demands on their behavior. Men were expected to remain stoic, to scoff at fears that they might become ill, and when they did become ill, to carry guilt alongside their misery. Women, alternatively, understood to have natural nursing tendencies, were expected to volunteer as nurses. Men who lost wives sometimes found themselves responsible for children, something for which they were both untrained, but sometimes also socially prohibited. In other cases, the loss of a father might leave families scrambling to make a living, sending mothers and children into the workplace, children in many cases made into adults and breadwinners overnight. And for the poorest of Americans, of course, the pandemic could quickly send them into hunger, into cold, even into homelessness, because they had no resources on which to fall back. For people of color, the circumstances were still more difficult. Their experiences framed by the disadvantages of white supremacy and the broader poverty and segregated healthcare system it produced. One or two examples. In Chicago, where the white press had already been stereotyping African Americans arriving in the city by way of the Great Migration as, quote, unhealthy, the health commissioner blamed Black people for the crisis. In Richmond, Virginia, though the Red Cross created emergency hospitals that served all of the city's citizens, African American victims were relegated to the basement. In Philadelphia, beds in white hospitals remained barred to African Americans entirely, and it was only the efforts of the Black community that facilitated the provision of professional care for their stricken. Today, too, the economic and racial disparities are landing with special force. Early evidence has produced predictions of significant growth in poverty as a result of the pandemic, with estimates suggesting that as many as 10 million Americans may be added to the poverty rolls and lead to what one article has described as a poverty epoch rather than simply an episode. The impact of these increases too will vary by race. Before the pandemic struck, I think all know that the net worth of a white family on average is estimated to be as much as 10 times that of a Black family, with the resulting consequences of a family's differential ability to sort of absorb the consequences, the economic hit of the pandemic, of furloughs and layoffs. In turn, some economists are predicting that poverty will rise twice as much for Black Americans as for white Americans. Poverty, in turn, has terrible health costs, with some scholars suggesting a 14-year difference in life expectancy today between the rich and poor in this country. Being poor, then, increases dramatically the likelihood that one will enter COVID-19, the pandemic era, with those pre-existing conditions that we know increase the likelihood of a critical case. In turn, being poor also enhances the likelihood of exposure in workplaces, places with inadequate protections, and also overcrowded housing. It's no surprise then that people of color, and especially African Americans, are dying from COVID-19 in unconscionably high numbers. Data adjusted for age differences suggests that African Americans are dying at 3.6 times the rate of white Americans, members of the Latinx community at 2.5 times the rate, Indigenous Americans and Pacific Islanders at rates much higher than their proportion of the population. This last data, by the way, is compromised by the fact that 5 states, Montana, Nebraska, Utah, North and South Dakota, all home to large numbers of Indigenous people, refuse to collect health data by race. So what does it all mean? As we look at these two pandemics separated by 102 years, by so many changes in science and technology, by meaningful progress in our social and cultural norms, it's crucial to ask what the persistent parallels might suggest about how and why we haven't changed in those 102 years. First, our wonder at facing the pandemic, this profound sense that this should not be happening to us, suggests we have not yet come to terms with our American exceptionalism and that we continue to believe that science can save us. In turn, our shameful lack of preparedness and the absence of strong federal leadership suggest an ongoing unwillingness to accept the vital role the federal government must play in a modern nation, or to fund those agencies that might have prepared and guided us more holistically through this catastrophe. The ongoing inequities by class suggest a cruel unwillingness to accept that the richest nation in the world should be able to afford to feed, clothe, house, and provide healthcare to all who inhabit it. And finally, the racial inequities, the racial disparities that this pandemic has revealed remind us that this nation has hard and crucial work left to do, dealing with our systemic and institutionalized white supremacy, a point that must finally feel extraordinarily obvious and pressing today. George Floyd could not breathe, hailing as well those Black people dying of COVID-19 who cannot breathe. Both realities should make us all reel with grief and anger at this ongoing violence against people of color in this country and move us to make change. And that's one of the key differences between the people of 1918 and ourselves. Their story is finished. I may continue to research and write about them, but they're no longer enacting their history. We are. We don't know yet is whether we will choose to act on what we're experiencing and whether we will choose to change. I hope so. Thank you so much.
Well, Dr. Bristow, welcome. Thank you so much for being with us on a beautiful summer evening.
It is a pleasure, as I say, to be here, and especially on behalf of the Seattle Public Library Foundation.
Great. Well, we recorded this back in July, and boy, a lot has changed since then. So what are your impressions as you look at the current environment?
They're not particularly different. I continue to be kind of stunned by and unnerved by the persistence of unwillingness to conceive what's really going on in front of us, the unwillingness to accept the leadership of our best public health minds, our best scientists. And I speak of that nationally. I think on the local level, I continue to be encouraged by what I see as really strong, persistently strong leadership at the local and the state level, for which I'm unendingly grateful.
Mm-hmm. So we asked our supporters to send questions in advance, and we had a number of questions about the end to the 1918 pandemic. And one person asked, was it a very slow end? There was no vaccine. So can you share a little bit about how that pandemic ended?
Yeah, and that's what we hope will be different, that we'll be able to actively help bring it to an end in a way that they couldn't in 1918, because they could not create a vaccine. They couldn't see viruses yet. So in 1918, they just kept waiting to see what would happen next. So they had the big wave in the fall of 1918. And for many communities, including Seattle, as things began to get better, another wave came along in the late winter, early spring of 1919, which I think really infused this sense of, oh my gosh, how many times are these waves going to wash over us? And indeed, in the spring of 1920, again, there appears to have been either a very serious first seasonal flu born of the pandemic, or perhaps the fourth wave of this pandemic. It was actually in February of 1920 that my own great-grandparents died within 4 days of each other, young adults, healthy with 2 children, a classic example of the kind of death we saw in 1918. But so again, they didn't know when it would end. And as late as the spring of 1920, there was a sense that they were very much still in the midst. My family's version of the story, though they died in 1920, was that they died in the flu pandemic. So again, just this sense that they suffered through this for not 1 year, but 2 years, and without a sense of whether or not it would continue to come back in the same kinds of ways, a way in which I hope, we're going to have a different outcome, because I think the vaccine, of course, will make a huge difference for us. We'll be able to put an end to this eventually.
And do you have a sense whether, a century ago, people took the pandemic as seriously as they're taking it today, or does it depend on the geography, or what resistance, or I think Rob asked, what resistance or impatience to health measures do we see back then?
Yeah, it seems so similar, that you have in the very beginnings of a sense that, well, maybe this thing won't be that serious. And then an awareness that, wait a minute, we are really in trouble here. This is a serious pandemic over which we do not have control, a willingness to step in line with whatever it was that public health leadership asked for. And then relatively quickly, the beginnings of resistance. In some communities, as was true today, concern about children, closing schools, and what would that mean for the children's education, closing houses of worship, what would that mean for our spiritual survival? What should we do about businesses? Can we afford the economic hit? So right away, some of those same questions, but in general, a willingness to say, okay, we see that this is a serious thing. Again, a sense that, but this is only going to take a couple of weeks, when in fact it takes a lot longer than that to get through a pandemic. And so a real rising of resistance. In 1918, in just the course of a couple, 2-3 weeks, people begin to say, well, you promised us this would help. And in 1918, the citizenry doesn't have the same understanding of things like flattening the curve, which today we know, even when we're doing well in the midst of a pandemic, people will still sicken and people will still die. But that if we can flatten the curve, fewer people will. We can take advantage of the medical opportunity that we have with ventilators, with antibiotics. So in some ways, I forgive them their rapid impatience, because they didn't have the same level of knowledge that we have today. So the parallels are very, very similar. But by the time I get to when the resistance really hits, I begin to have greater understanding for what they were going through than to be perfectly honest with what I'm seeing today, and what I see as an unconscionable unwillingness to look out for one another.
Mm-hmm. So we've had a question about how do we convince others, particular people in different geographies, to take the measures seriously to prevent the spread of the virus.
And I wish I had an easy answer for that. And I think if there was one, we would already be doing it. One thing I will say that is a lesson from 1918 is that when the public health leadership is really direct, really clear, really honest with the people from the very beginning, it helps. And again, I think that's one of the things that's worked so well for us here locally. And it's where I think we've really had problems nationally and in many communities around the country. And when you look at which states, which communities are really suffering, and I looked at the map just before I got on the show here, and it's just so awful to look at the southeastern United States. It's just heartbreaking to look at. My more recent research is in Mississippi, so I have a lot of friends who live in a region that is just under siege right now. Florida just announced they've had 500,000 cases in that state. How do we convince people in communities that at this point are still really suffering and yet still resistant? I wish I knew the answer. I'm afraid that the data ultimately will be the thing that will convince, because we are seeing that our community is doing relatively well compared to communities that have chosen not to follow the public health guidelines. The tragedy in all of that, of course, is that it will take a great cost, great loss of life for that data, I think, ultimately to convince people. Because even today we have people still describing this as a hoax. We still have leadership in some communities prohibiting people on their own staff from wearing masks. I mean, it doesn't make any sense, and yet it's still ongoing.
And back in 1918, were rural areas of the country hit equally hard?
They were. It was really stunning, actually, that communities that literally couldn't even figure out how the virus had gotten to them might be, just terribly hard hit. Indigenous communities up in what was not yet part of the United States, or was a territory up in Alaska, some of the indigenous communities up there were literally wiped out. And these were in very remote locations at a time of year when it was very cold. There was little traveling going on. And yet, and similarly, islands in the middle of the Pacific, where some of them were very hard hit. And inside the United States, indeed, rural communities were not safe either.
Interesting. And a question about whether or not have any Seattle officials or local health professionals reached out to you to sort of seek your advice on the issue?
Thank goodness, no. I'm not an expert. It's funny. My brother is, in fact, an expert. He's a geneticist and helped to set up testing, some of the testing that's done here on Vashon Island, where I live. And he, for instance, has been, people have reached out to him from the University of California system, for instance, to ask questions about what they should do with reopening schools. No, experts are not asking me, and that's for the best, because historians can't predict the future. We're very knowledgeable about the past, but we can only prognosticate, and even that makes us pretty nervous.
Well, you expressed your appreciation to local health officials, and one of our viewers is the family member of one of those people, so she will express her appreciation. Please communicate your appreciation to her family member. How, now we have sort of widespread air travel. Why was the 1918 epidemic so rapidly spread?
Yeah, there's two answers. One is we're in the midst of a world war, so there are troop transports traveling all over the world. And remember, this is a time when many of the European nations were still empires, so they were drawing troops from all over the world. And that's all coming together on the Western Front. So you have this sort of, I don't even know what to call it, a cauldron of boiling, rampant, horrific disease. And that's the second thing, is that this was a particular virus. Each virus is different. The virus in 1918 was extraordinarily infectious. Think again, a third of the population of the world was infected. That's unbelievable to us right now, right? A third of the world, and even in the US, 1 in 4 people. And because it was so infectious, again, that really just helped it spread very quickly all around the world. And it did so really in the course of a couple of months, which is, again, is kind of hard to imagine before we had air transport like we have today.
So Eric's posing an interesting question. With all the parallels between the 1918 pandemic and the current one, do you see any interesting contrasts with these pandemics and how the U.S. Has treated other nationwide health crises like polio or HIV?
Oh, that's such a good question, and I wish I could offer a better answer because I'm simply not sufficiently expert, I think, on those other pandemics. What I will say is one thing that's interesting historically generally about the history of medicine, and that is the ways in which we do in fact deal with different illnesses and different moments of illnesses very differently depending on what the illness is. So the mention of the AIDS crisis, for instance, is a really important one here because as those who are as old as I am remember this vividly. I was living in the Bay Area at the time. There was sort of a national reticence to engage with the problem of AIDS because it was seen to be associated with a particular population, with gay men, and this idea that it was only going to infect that population. And so at the level of the federal government, there was a willingness to kind of ignore the problem for far too long, of course, enhancing the ways in which it then did take off in the general population. And so we refer to that as something called the social construction of disease. It matters what you have, how people respond to it. And I think that's part of how we can understand the difference between some of these pandemics, where AIDS, we were very slow to act on that as a nation in ways that are unconscionable as we look back. And I think we continue to see that AIDS is a real worldwide global problem, even in 2020. But sort of the world health, we're able to ignore it in some ways because of whom it's affecting. So I think I can't make any really clever pronouncements about particularities, but in a more global sense, I would mention that, you know, the way we can consider a different disease really depends on who is being affected by it and the nature of that illness. And I think if you look through that lens, you can make sense of some of the differences that we see.
Okay, so shifting gears a little bit, a question about schools. And so lots of districts now, including your own school, are moving to distance learning for the fall. How long were schools closed back then?
It really depended on the community. Some places kept them open. There was a really strong sense in 1918, especially in major cities that had a lot of immigration coming into them. And I remember this was a moment of expansive immigration in the United States during the war. So both Chicago and New York never closed their schools. They actually keep their schools open with the belief that they could use the children as an educational mechanism for the families, that the children who could speak English and were in the schools could then report home about proper measures for handling influenza, and that children, because there was so much poverty, might actually be safer if they were in the schools, rather than they had nowhere else to be, so they would just be in the street or in their crowded homes. So in 1918, some schools literally didn't close, but that was especially in some of these really major metropolitan areas of the Midwest and the East. And then it could be for several weeks. It could be a month. It could be 2 months in some communities. I can remember reading some letters. I won't remember the location, but somebody complaining about having been out of school. That was just wonderful because here's some 15 or 16-year-old complaining about not being in school. But they've been out of school for weeks and weeks and weeks. They closed in October and they didn't go back to school until after the first of the year. So it really varied enormously community to community, just as it's doing in 2020. Which again is really sort of shocking to me, that we could continue to have so much variation, state by state, county by county, and yet in some ways that makes sense. Some communities are in different places in the pandemic than others, and I wish it was only that was determining the opening process.
So how long did you, your depth of knowledge on the subject is really impressive. So how long did it take you to write the book, and how long were you researching the 1918 pandemic?
Did you have to embarrass me totally before we finished up, Brian? It took me 15 years to write that book, and it's not a very big book. It's pretty skinny, really, when you get right down to it. It was a lot fatter before I had a good editor. But I was researching it before the internet was really up and running in the same way in terms of digital access to historical materials. So I was traveling all over the country to local historical societies, to state historical societies, to university libraries, just looking for that proverbial needle in a haystack. When I started, I was still looking some things up on a card catalog, which is just like, who's, kids who are listening, don't worry, they don't exist any longer. So it took me a really long time, and partly because I had to learn a lot. I didn't know anything about the history of medicine when I began, but I became intrigued by way of my own research earlier on the First World War era, and then just discovering the story about my great-grandparents, which I'd known my grandpa really well and didn't know the story. And when I heard that, it was like, okay, I got to go do this thing. It'll take me off on a side road, but off I went. And I stayed there it was a long, strange trip it's been. I'll just say that for those of my generation will get the reference.
Gotcha. Well, we're gonna take a couple more questions, then we'll wrap it up. But one question that came in is about, this is a major event, and why is it? Do you think why wasn't it as well known to society until now?
That's a wonderful question, by the way. And that was the other motivator for me, was I wanted to understand what happened to my great-grandparents, and there just was nothing that really told the story, except for one really terrific book by Alfred Crosby. There was very little social cultural history about it. And our understanding, I think this is shared by a lot of people who've looked at this question, that World War I was really key here. It was a major event that preceded the pandemic, helped to cause the pandemic, surely, and in some ways outlast the pandemic, because the peace conference, of course, goes on. And so on one hand, the war just sort of overshadowed it. Even during the war, again, that's why Wilson doesn't speak of it. He wants the nation's focus to stay on the war. The other thing I think that's really important is that it wasn't a story that fit with Americans' perception of themselves. It's part of what I was talking about at the end there, that Americans have this notion of themselves as like, here's the one country that was born perfect and then got better. And World War I sort of fits with that story. We come into this war that the world powers are fighting. They can't seem to end it. We march in, we end the thing in a year and a half. We are victorious in it. It really speaks to the way Americans were thinking of themselves in 1918, 1919, 1920, and the memory they wanted to carry forward. It fits better with the general American historical narrative. And I think that's part of what happened to it. People grabbed hold of one story and not the other. I'd mention one thing next to that answer, which is it was forgotten in the public sphere, but it's really important to remember that though I never talked to my grandpa about it, he didn't forget it. I did an interview with a woman, Lillian Kancianich, from North Dakota. She was living in Tacoma at the time, and she had lost her mother when she was 5 months old in 1918. And I asked her about the pandemic. She had no memory of it, didn't remember her mother. But when I asked her, did the pandemic affect your life? She said, it changed my life completely. It had to. So even not even knowing, not even having any visceral memories of it, she still remembered this as the key event of her life. So it was remembered in the private sphere. It was remembered in people's lives, in families. And when I give talks, if we were doing a smaller group, there would be somebody here who would tell us a story about their family during the pandemic. So it was remembered, but not really accounted for in public, in our broader narrative that we tell about the country.
Great. And question from Max about misinformation, where, obviously we see a fair bit of misinformation out in the public today, but was there a misinformation spread in 1918?
Yeah, and you can see me smiling because those are some of my favorite moments during the research for this. And when you're researching something that is so sad and really just filled with trauma, I had a couple of experiences that were just wonderful. One was finding a folder of letters written to the president about all the other causes for the pandemic. And it ranged from sunspots to the most popular was that this was actually something done by the Germans and that they had somehow come ashore with nobody noticing them and had poisoned us. Another theory was that it came from Bayer aspirin. So it kind of got bound up with the war and this idea that this has to be done by the Germans, because how else could it be happening to us? And the other strain of it that was always super interesting for me was the way that folk cures became really powerful for people, because the things that contemporary modern medicine was suggesting, what clearly wasn't making a difference as far as people could tell at the time. Now we know those things actually did make a difference, but they couldn't see it so clearly in 1918. So the cures people had were just wonderful. And again, coming across files of letters about if you boil several red bell peppers for a certain length of time, and you do a certain incantation over the steam and breathe it in. There were others about wearing onion necklaces, asafoetida necklaces, onion poultices, black tar. You should drink a lot of whiskey. You should abstain from whiskey, you name it. And then the very best were all of these patent medicines that were sold at the time. You know, you could look at the ads from August and they're being sold to cure a stomach problem or get rid of your headache or muscle tension. And as soon as the pandemic hits, they actually cure influenza, of course. So it wasn't the kind of misinformation from the top. It was much more populist misinformation, but it was there. It was used to sell products, and it was also used, I think, to reassure, to feel like there was some way to control this thing. And for me, that's a pretty understandable human response.
Yeah, I bet. So we'll take one final question from one of our fantastic foundation board members, Ann Repass, and it was about the Southern Hemisphere and whether the Southern Hemisphere was impacted as severely as North America.
Yeah, great question. And again, I won't be as knowledgeable as I should be because I'm a US historian, but I have a good friend, Howard Phillips, who's written some work on South Africa, in fact, and I would recommend his work to you. Again, just like it sounds, Howard Phillips. He's written both a history of the pandemic in South Africa, but also he's done an account of oral histories he did with people living in South Africa who still can remember the stories and talk about what it meant in their lives. Including Black African people, not just the Afrikaners, not just the white community. And it's an amazing accounting of what was happening to people in the Southern Hemisphere as well, and in nations where the racial apartheid was even worse than it was here in the United States. So yes, it did hit the Southern Hemisphere as well. Obviously, because of how seasons work, the timing on it may have been a little different, but I'm not convinced that that's the case. And I'm just not quite sure exactly the moments that they were suffering through it. It may have been off by a few months. I don't know that.
Okay,
Great
so
question.
Before we let you return to your family, quick question about your latest work. So tell us about your new book, which was just published in March.
You're so kind. That's really sweet of you to ask. It's called Steeped in the Blood of Racism, and it considers a shooting on a historically Black college campus in Jackson, Mississippi in the spring of 1970, just 10 days after the shootings that are better known at Kent State University. Mississippi Highway Patrol and local Jackson police officers marched onto a campus where there had been a minor disturbance. And when that disturbance is handled, marched into the middle of campus, turned towards a women's dormitory, and when a bottle hits the ground, they opened fire. So I was interested both in recounting that story and making sure that it became better known, but also in using it as a lens for thinking about the ways in which violence against people of color in this country was allowed to persist with new rhetoric in the aftermath of civil rights legislation. You need new excuses, in a sense, for the kind of misbehavior we saw in 1970 that unfortunately can still happen, obviously, here in 2020. So my editors have teased me that could my next book be about puppies, kittens, and rainbows, because each thing I write about is feeling very relevant right at the moment. And they're hoping I could bring something else into the public sphere and make it relevant, like let's have more puppies and kittens and fewer pandemics and less racial violence.
I told my team that if you write a book about stocks, I'm definitely going to buy it because you seem to be picking very, very timely topics.
Yeah.
So again, thank you so much for being here, and we are so grateful for you making this presentation, and we look forward to staying in touch, and thank you for being a wonderful supporter of our libraries.
Yeah. Oh, thank you, Brian, and thank you to everyone who is here today, and especially those who are your volunteers and your supporters. We all know how important you all are, so my honor to be with all of you today. Thank you.
Great. Thanks so much. So to everyone, we are going to send out a link after the event, which will contain our post-event survey. We'd love your feedback on how we did and what we could do to improve in the future. But we're also going to be including a link to Nancy's books from our partners at Elliott Bay Book Company. So if you want to check those out, please check the library collection or feel free to utilize that link at Elliott Bay. And just a reminder that on next Wednesday, August 12th, we'll be bringing you our next edition of the Stay Home Summer Series. It's called Lunch with a Publisher, and we'll have Liz Camaford from the Penguin Random House Publishing Company, and she's going to give you an insider's look at some of the books that will be published over the next several months and in the next year. And so she'll be available to take your questions, make recommendations, and she even has some wonderful reading copies, advanced reading copies as prizes to give away. So much more to come on that. Later this month, we also have a plan giving seminar that will guide you through the basics of estate planning, which you're welcome to join us for. We do those in partnership with our friends at the King County Library System Foundation. And then that kind of wraps up our program. So again, thanks to all of our supporters. We are so grateful for all you do. Thank you to our volunteers and all the members of our library community. And Dr. Bristow, thank you for sharing your time with us today. Take good care.